Okay. In immunopathology from Montreal University, we have autoimmune disease. Okay, as we see, autoimmune is immune reactions against self-antigens in body tissues. It is include or mediate tissue damage made by all types of hypersensitivity reactions except type 1, more common in female than male. It results from combination of inheritance and environment related or linked with HeLa type, class 2 alleles, okay, DR and DQ. We take first thing is rheumatoid arthritis, which is multi-system disease and is a chronic disorder with autoimmune origin, attacks the joints, producing non-supportive proliferative inflammatory synovitis. Okay, it affects on small joints of the hands and feet, asymmetric arthritis. Also, there will be extra-articular lesions in skin, heart, blood vessels, lungs. 3 times more common in female. We know the biggest it is 3rd through 5th decades of life. Pathogenesis we see here. Environmental or genes. Both of them, genes, tolerance, failure of tolerance of lymphocyte, while environment induce enzyme modification. Okay, both of them will lead to T and B cell responses to self-antigens. Okay, with antigen in joint tissues, and this will stimulate lymphocytes, antibodies, and complexes interjoints. So all these will. So then, by this summary, we can conclude that HeLa genes and environmental factors. HeLa genes work on produce the failure of tolerance of lymphocyte, while environmental factors will cause enzymatic modification of cell protein. Both of them present in the patient will lead to immune cell responses to self-antigen. Self-antigen, as we see, okay, including antigens in joint tissues. This is not meaning the patient has antigen. No, it's meaning the joint tissue is self-antigen, is antigen. So the body, because of these genes and these environmental factors, will attack the body tissue, produce antibody, and attack the tissue, cause injury, and formation of immune complex, antibody antigen complex in the joint tissue. This will lead to release of cytokinase, fibroblast proliferation in synovial cells, and all these fibroblast one increase in number will lead to secrete of cytokinase. Okay, or proliferate by 2 ways, or direct by cytokinase will lead to formation of bonus formation with destruction of one and cartridge. So see here, CD4 initiate this reaction. T cell produce cytokinase to stimulate inflammatory cells. Okay, the patients have serum immunoglobulin M or A autoantibody called rheumatoid factor. Okay, deposit in joints as immune complexes. The inflammation localized to the joint, recruiting macrophages, regular activation and or proliferation of synovial cells, chondrocytes, fibroblasts. Pathology of rheumatoid arthritis. Synovium is thickened, hyperplastic with villi formation. The characteristic histologic features include synovial cell hyperplasia and proliferation. Under microscope, we see hyperplasia proliferation from fibroblast or chondrocytes or synovial cells. Also, you see inflammation part infiltrates like CD4, BCL, plasma cell, dendritic cell, macrophages. Increased vascularity, which is a type of chronic, okay, because of inflammation. Neutrophils and fibrin on the synovial and joint surfaces may be related to fibrinoid necrosis. Osteoclastic activity underlying bone indicate there is disease. Allowing the synovium to penetrate into the bone causing periarticular erosions as subchondral cyst. Banus formation, mass of edematous synovium. Dead tissue, damaging tissue. Banus formation is in tissue, joint tissue that get injury or distraction, nothing. So it will just contain edema, inflammatory cell, coagulation tissue, fibroblast. Okay, and this result of erosion, rheumatoid nodules. Okay, it is related to rheumatoid arthritis, occurs subcutaneous tissue like forearm, elbows, occiput, and lumbosacral area, microscopically necrotizing granulomas. Necrotizing granulomas, as we see here. Of the joint lesion, this is joint lesion, this is bonus. Immune complex will be leukocyte at first. So there is inflammation occurring in this picture. And we see here immune complex and inflammatory cells that is focused on the area of the bonus. Okay, all these occur in the synovial cavity, particularly in the synovial brain. And this bonus, it is the dead tissue of the joint or the damaged tissue of the joint. B shows under microscope synovial hypertrophy with formation of villi. We see here hypertrophy and villi, all these villi. But anyways, high magnification synovial tissue, and there will be lymphoid aggregate. All these are lymphocyte. Rheumatoid nodule, as see here, there is deformity. This nodule called deformity for the hand, and this is named by swan neck, deformity of fingers, and ulnar deviation at metacarpophalangeal joints. While the thumb, it is named by boutonniere, deformity of thumb. This occurred in late stage. As we see here, composed of central necrosis, remained by palisaded histiocytes. Okay, that may be so enough for today. Just rheumatoid arthritis. Thanks for watching.